Hello good people, this is Dr. Cross TV, the physician and health coach. Today we are discussing peptic ulcer disease. We want to be empowered with the adequate information to be able to handle the illness. That is for those who are having challenges with peptic ulcer. Our outline shall be, we're going to consider what is a peptic ulcer, what causes peptic ulcers, symptoms of a peptic ulcer, complications of a peptic ulcer, diagnosis of peptic ulcer, treatment of peptic ulcer, prognosis, and how you can prevent a peptic ulcer. So follow us on the right. What is a peptic ulcer? Now, peptic ulcer is a sore or wound on the lining of your stomach or upper intestine. Now, when we talk about wound, it's just similar to you having a cut on your skin. When you have such cut, it will be painful, it could bleed, and you want to apply bandage or even suture it at the end of the day. And after a few days, it heals. The same thing happens inside your stomach. The stomach is a place, the part of your body that receives the food you eat. And it has special lining inside. Now, the special thing about the stomach is that it contains acid, which helps you to digest your food. Now, the lining of the stomach prevents this acid, which is as concentrated as the acid you have in the car battery. You know, the acid in the stomach does not digest the stomach lining. But if you take the same acid and touch on your skin, it could digest, it could burn your skin. But in the stomach, it doesn't behave like that because of this special lining. So when we have a wound in the special lining of the stomach, that is when we talk about ulcer. Then acid from the stomach can now begin to invade the underlying tissues, just as we see in the diagram on the screen. You see in the stomach, if you look at the diagram on the screen, you are going to see the healthy stomach. Then the one in the middle is the one that has ulcers. You know, there are two types of ulcers there. One inside the stomach itself. You can see the ulcers inside the stomach, and then you can see that one is called stomach ulcer. Then the ulcer that is immediately outside the exit of the stomach is called duodenal ulcer. So two groups of ulcers, either stomach ulcer or duodenal ulcer. Now if you look at the far right, you are going to notice the breach or the wound in a magnified form. You can see the breach, you know, which now makes it easy. The breach in the lining, which makes it easy for acid in the stomach to begin to invade the underlying tissue. So that is what we call peptic ulcer. Then the other thing about peptic ulcer is that it can affect any person. Anybody is prone to peptic ulcer, but the older you get, the higher the risk of you developing peptic ulcer. Now, what are the causes of peptic ulcers? There are two common causes, two major causes. One is a bacterial infection called H. pylori infection. You know, if you look at the diagram on the screen, you're going to see the diagram of the stomach, but with some green rods which have tails. Things that look like tails. These are the Helicobacter pylori infection, or H. pylori. Now, these bacteria have the ability to survive inside the stomach, and they will remain quiet there. And then what they do is that the activities will begin to weaken the lining of the stomach, which will eventually lead to destruction of the lining of the stomach, and then ulcer can result. Now, one thing about this infection is that about 50% of the population are infected with H. pylori. And most people that have this infection don't even know they have the infection. So, and it can be transmitted through food or water or even through kissing. So, when somebody is in in romance or in love with somebody and you're kissing, you could be transmitting H. pylori infection. That is not to discourage you from falling in love with anybody, but just to give you the information that something can be done to prevent such a thing from messing up your love life. So, other causes of peptic ulcer, the second important cause is the long-term abuse of painkillers, or the group we call the NSAIDs, or the non-steroidal anti-inflammatory drugs. Examples include the popular painkillers that we know: aspirin, brufen, diclofenac, naproxen. So many of them fell in. What makes this information important is that a lot of people abuse painkillers for every little reason. You go to pharmacy, you see a lot of people, the commonest drug that people come to purchase, even without prescription, is a painkiller. That is the commonest drug. And one thing that the painkillers do, the NSAIDs, they block the activity of a substance called prostaglandin, which the body normally produces to maintain the integrity of the lining of the stomach. So the more of the painkiller you take, the less of the prostaglandin you produce, and the weaker the lining of your stomach gets, and then the higher the chances of developing ulcer or peptic ulcer. Now, other factors include smoking cigarettes, drinking alcohol, stress, eating, or fasting. Or people talk about these things. We are going to talk about the importance of these things. You have to note that smoking and drinking alcohol, they can make you more likely to get ulcer, and they can make ulcers more difficult to treat, but they are not the primary causes of ulcer. The same thing applies to stress and eating a lot of spicy foods, or even going hungry or not. So these things can worsen ulcers, but they are not the primary cause of ulcers. So, but they can make ulcers worse and harder to treat. So the next video we are going to do is to look at the symptoms of ulcers. So meet us in the next video. If you enjoyed this information, please like and share it to others. Thank you.